Hey guys, this is Stacy from Easy Acupuncture School, where we take the mystical and make it practical. Um, it's been a while since I've done any videos or posted anything. I've just been very busy in the clinic, and I've been working on this other classical acupuncture project. So I've just been busy, and I haven't been able to do anything. But today we're going to do something that's exciting. Is what to do with a pregnant person. So other than leave, if somebody calls and says I'm pregnant, oh my gosh, I'm leaving. Call somebody else. No, that's not what we do. Um, I know that there is a little bit of precaution working with pregnancy and a little trepidation and hesitation with people who've never worked with pregnant women before, and that's okay. But I'm here to help you feel more confident. I um, work with a lot of women all the way through their pregnancy, and especially at the beginning of my career, I did a tremendous amount of work with a lot of pregnant women, and it's kind of cool because what happens is, especially when you get old like me, you suddenly start to um, treat kids that you knew before they were born. It's fun. I had a patient a couple of months ago that brought her daughter in that was 4, and I was like, "There's no need to be scared of me. I knew you before you were out here. I knew you when you were in your mom's tummy." And that's kind of cool. I also have children that I'll work on their moms before they're born, and then I might not see them for a bit. I used to do a lot of pediatric work, and a lot of times you'll see kids up until the age of maybe 6 or 7, right when their immune system really kicks in, because in the first few years, especially when they're in school, they are sick all the time. And that's probably going to be my next videos. I'm going to talk about how to work with children. But then you don't see them for a while. And next thing you know, they come in and they've hit puberty and they're bigger than you. And you're like, oh my God, how did you get so big? I knew you when you were the size of a bean. So it's really fun, very rewarding, and nothing to be scared of. I'll go over in the end of this lecture uh, some resources that you guys can use, but also find a good class because that will help you build your confidence in things. But let's get started. Okay. Let me get my magic screen going here. I'm trying something new. So hopefully it won't take so long. Let's try this. Oh, look at there. So who am I? I am Stacy Hewitt. I'm a licensed acupuncturist and a licensed massage therapist. I've been a full-time acupuncturist for 13 years. Don't ask me how long I've been a full-time. I'm not full-time, but a licensed massage therapist. It's too long. I was like 28 years. I've been an acupuncture teacher for 7 years, and then you've probably found this video by checking out my YouTube channel. But if you haven't, check out my YouTube channel, Easy Acupuncture School. There's the link for it right there. Also, there is the email address for that YouTube channel. If you email me and say, hey, I want to subscribe to your newsletter, which you should, it gives you access to this drive, a Google Drive that has all of the student lectures that I do and has all the documentation for them. I mean, everything, basically all the PowerPoints turned to PDFs so you can read them at a later date. So do that. I forget to do this. Like and subscribe to my channel, and let's get going to the real stuff that you're here for. There we go. Not working. I was like, oh my gosh. So how to work with pregnancy. So like I said, you have a person call you up and say, I'm pregnant. Um, can you work with me? Then after you take some classes, after you see this, you'll feel comfortable enough to say, yeah, I sure can. And it's, like I said, very rewarding. Some so common issues that you see with pregnancy. So these are just the basics, right? Some fatigue and exhaustion. That's a big one. Morning sickness. That is a huge one. Morning sickness, with the way I treat, other people treat more frequently, and I'm not dissing them at all, but just the way I treat. I usually see my patients for typically once a week. I usually tell them in the beginning, I need to see you once a week, 4 to 6 weeks, and then we can hopefully start spreading your appointments out. Morning sickness, especially when people are really in dire situations with it, when it's really bad, I will see people up to 3 times a week with morning sickness. I mean, I'm talking about some people get so dehydrated from throwing up, they are having to go to the emergency room for IVs. Those are the folks that not everybody that I see with morning sickness, that's not what I'm saying. I see them multiple times a week. I'm just saying morning sickness can be a beast for some people. So um, figure out how to treat it because you can really help folks with the treatments. And I'm going to talk about how to do that. Ta-da! Bonus at the end of this. So anyway, like I said, morning sickness can be rough for lots of people, but it can be very rough for some. You can deal with pain and discomfort all through the pregnancy. Different things will pop up: back pain, hip pain, pelvic pain. And sometimes they'll get even carpal tunnel from their wrist swelling. Sometimes you'll have pubic symphysis pain, which is a little tricky to treat. But there's a lot of different pains that will pop up. And just think about the dynamics of the body, how gravity is pulling on it differently once people get more pregnant. You can't really see what my hands are doing, but I'm kind of saying, like, as the stomach grows, their center of gravity changes. And so there can be a lot of different things that pop up pain-wise, and you can help with that. Reduce stress and anxiety. Pregnancy is a beautiful time, but it's also very stressful. You got a lot of planning. You got to get that baby's room painted. You got to deal with the mother-in-law wanting to be too busy with what you're doing, or maybe even your mom, or your dad, or your dads, or your moms, whomever. So it can be sometimes stressful. Your body's going through changes. Women's bodies are going through changes. Potentially, if it's their first pregnancy, they haven't seen these changes before. So that can be stressful. It can be also anxiety provoking for anyone. First pregnancy, fifth pregnancy. The process it can be a little nerve-wracking, but it's beautiful. It can be a little nerve-wracking for some people. So acupuncture can help with that. Sleep. Sometimes people's sleep gets thrown off. So acupuncture additionally can help with that. So these are some things that you can, promo as when people ask you about pregnancy, what can you do? Well, this is what I can do. Here's some other things that um, acupuncture can help with. They're not as prevalent. They are not saying that it doesn't happen, but people they come in for this, but not as frequently as these things that I just mentioned. But they do come in with this, and you can help with this as well. Um, Especially miscarriage prevention. Threatened miscarriages, acupuncture can be beneficial for that, definitely. Gestational diabetes, pregnancy-induced migraines, pregnancy-induced hypertension. These are some things that are not uncommon, but there might not be the first things that you think of when you think of what can acupuncture help with when a person's pregnant. But here's some other things. This is not a definitive, complete list. There's a lot of other stuff that it can help with, but these are the most common uncommon things that you will see with pregnancy with people that are searching for acupuncture for assistance with these things. And you can help with those. You can help with those. Another thing you look at is labor preparation. And usually that starts about week 37 to 38. And what this is you're providing acupuncture to help them have a more smooth and more positive delivery, meaning more easy, not positive, easy. So a lot of times, and we're going to talk about this in a little more detail, when I'd see people and I would talk to them really about what acupuncture can do in these last weeks, outside of the other things that we've already spoke about. Because I don't use a lot of Chinese terminology when I try to explain things to patients because sometimes it just goes over their head and they're like, "You're talking in the language of witchcraft. What do you mean?" So a lot of times I would tell people, you know, this preparation is like you think of a pilot in a plane. Whenever you travel anywhere, there's always a pre-flight checklist. They go through all the equipment to make sure it's working. And then once they know it's working, the plane sure flies a whole lot better. And it's like this preparation acupuncture is very similar because it's almost like when you're doing the acupuncture, it allows the body to go through its checklist to make sure everything is optimal, everything is good. And once it goes through its pre-flight, it's a little bit of a tongue twister there, pre-flight checklist, then it knows it's ready to go. Not that day. I'm not saying as soon as it does that, then they're going to be dropping a baby, but I'm just saying it allows the body to know that it is in a good place to start thinking about going into labor and delivering a baby. Not today, not the day that you're working on them, but just in the future. When we work on people, and we'll talk about this a little bit later, but this just popped in my mind. Um, you want to be very cautious and do very simple treatments. You don't really want to do a lot of treatments that are all crazy and moving energy in all different ways. You don't want that. You just want it to be very simple because that's very effective for a person that's pregnant because they have a lot going on. You don't need to add any more fuel to the fire. Um, but, and I'm not saying throw caution to the wind, but I'm saying a lot of times the body, you know, like I said, we start doing this preparation. It's even though you're preparing the body, it's not like it's going to go into labor that day. If someone's really healthy, oh, I don't want to say this because it's going to make people say, I'm going to throw caution to the wind. And this is not Stacy telling you to do anything and doing all the contraindicated points. This is not me telling you that. But a lot of time, if a person is healthy, they're more resilient to any type of energetic work causing any kind of miscarriage. Not saying that or go into labor. I'm not saying that it, doesn't. That's not what I'm saying. It's just what I'm saying is if someone is healthy, they're less likely for that to happen. But always use caution when you're working with a pregnant person. I'm not saying throw caution to the wind. That's not what I'm saying. I'm just saying the healthier they are, the less of a proclivity they have to go into labor prior to when they're supposed to. So let's go back to this labor preparation. And here are some of the things that when you're helping them with labor preparation, this is what acupuncture does. It helps benefit them in these ways. One of the things is it ripens the cervix. And what does that mean? It's not a fruit growing on a tree. It's ripening the cervix is a term used for helping the cervix to start to soften to prepare for labor. They're not going to be going into labor that day or going into labor in your office, hopefully, but I haven't had that happen yet. Um, but this helps like I said, ripen the cervix. This is terminology that you'll hear when people come in and they're getting checked in the last few weeks. They'll be, they'll be talking about the facing and the ripeness of the cervix. So be aware of that. The other thing that acupuncture can help with is the release of oxytocin. So oxytocin is involved with regulating, I'm sorry, it looks like I spelled that wrong. Regulating uterine contractions. It also helps with lactation, milk production. Also, oxytocin is a hormone that really is involved with bonding with your child. So it helps with that. It's a feel-good hormone. So that's another thing. This oxytocin is another benefit that acupuncture can do, or helping the body produce that. It also helps build resources. The body is burned up during pregnancy, meaning it helps build chi and blood. The body is going to be losing some chi, and definitely is going to be losing some blood when there's delivery happens. Also interstitial fluids. All of that stuff is yin based. So this acupuncture can help their body prepare for the resources that they will lose, or um, a lot of people don't like this terminology, but it's true. Babies are cannibals. They cannibalize the mother's resources. So this helps build those resources that have been cannibalized. The other thing is it encourages, like I mentioned before, more natural and efficient labor. And a lot of times when they go into labor, their labor is shorter, it's easier. So these are some the other benefits that you can tell people when they're asking you, how does acupuncture help pregnancy? These are some other benefits. Sometimes you don't, sometimes it's not a perfect, like I've said, if you watch other lectures, acupuncture is not magic. Sometimes, it doesn't work like we would like for it to work. And that's okay. Sometimes they still need medical intervention. But a lot of times when they have preparation done, then even with medical intervention, it is the labor is easier, quicker. So like I said, it's good stuff. It's good stuff. You'll enjoy the time that you spend with your pregnant patients. Here's some cautions here. Check to see if they have any histories of miscarriage, or and if they do, it doesn't mean that you can't work with them. It just means, A, you want to be aware of these, so you don't think if something happens, what you did caused it. And B, that lets you know I need to be really, really gentle and simple with this person. I don't need to do any kind of crazy acupuncture where I'm telling them they got to stand on their head or something like that, which I don't do. I don't, and there is no kind of acupuncture where you tell a pregnant woman to stand on her head. I was just making that up. But it just letting you know that they have, or asking them, if they have a history of miscarriage, just allows you to know that you need to be extra precautious. Doesn't mean that you can't treat them. It just means that you need to be extra precautious. That's all. The other thing is we all know these. We should know these. We had to know these to pass our board exams. But here are the contraindicated points for pregnancy. I've seen in different books, there's many other add-ons that you will see here and there, but these are the ones that you commonly see in what you're tested on. Spleen 6. And why is spleen 6? I'm going to tell you a little bit about why each one of these are contraindicated, so you just know. So think about the spleen. One of its jobs is to this upbearing, keeping the upbearing energy going, the energy going up. And the theory behind spleen 6 is the more you stimulate it, you start to exhaust the point. And the fear is if the point gets too exhausted, all the upbearing energy of the spleen starts to collapse. Think of the spleen chi sinking, right? So if you exhaust the spleen via spleen 6, then there's a potential that the baby falls out. I mean, the baby, it's not going to just fall out, but you know what I mean. It's like that's why it's a contraindicated point because they don't want it, and they want the energy to be going up. Not damn. Large intestine 4. One of the things, or one of the reasons that is contraindicated is because large intestine 4 is felt to be a point that really stimulates movement of energy. And when you're working with a pregnant person, you don't want a lot of energy moving around, a strong movement of energy. You want energy moving, of course, but you don't want this strong movement of energy. Bladder 60 is also a point that is thought to deal with uterine contractions. So they want you to stay away from that point. I've seen uh, bladder 67 listed in some places. And the reason I put in parentheses is you don't see that in all resources, but bladder 67 is a point that a lot of times when people have a breech presentation, which means the baby's pointing the wrong way, um, bladder 67 is used to help turn the baby around. And so they want you to be precautious with that point because they don't want you to be flipping a baby around when it doesn't need to be flipped. Gallbladder 21, they have a really strong down bearing flow on the energy. So they want you to stay away from that. And typically you see conception vessel 3 around that area because they just don't want you to be around that local area anyway. So it's quite close to where the um, uterus is, where the little bean of a baby is at the time. And then as a person gets more and more pregnant, you will be needling their abdomen anyway. There's a resource that I'm going to show you in a few minutes that's really kind of cool. It shows you by week, like where the baby should be in the abdomen. So you can those are the areas that you don't want to be needling. But to be safe and sound, just stay away from that area. And then I've seen other resources list conception vessel 3 through 7 because it's all the lower abdomen. But anyway, like I said, I'm gonna point you to a really great resource in a second, and it'll show you where what you need to stay away from via each week. How to position, and this is the most important part if you've never of this whole lecture. If you've never worked with a pregnant person, it's all about the positioning of them. And the very first thing to always remember is positioning them on the left side. And generally, not Chinese medical practitioners, not acupuncturists, but Western medicine. They usually recommend after the first 12 to 14 weeks, it is no more back sleeping. Sleep on your side, sleep on your left side. Most pregnant women, they sleep or rest on their left side. Occasionally they'll flip over because their left side needs a break. But most of the time, most of them are tried and true on the left side. Why the left side? And this is Western medicine stuff down at the bottom here that I highlighted and underlined, but it improves blood flow to the fetus, heart, and uterus, and kidneys. It also reduces pressure on the liver, and that can help with reducing some of the swelling in the hands, ankles, and feet. The big thing is about the blood flow, and you want to just keep them on the left side. So, what are we going to do when we have a person? We're going to be like, okay, I'm going to get you to lay down. So this is how you're going to position them. And sorry, some of these pictures are not the best, but I didn't currently have a pregnant patient that wanted to be photographed. So I just had to do what I could do and take what I could get. But you're going to have them laying. You can see this woman right here is laying on her left side, and you'll have a pillow underneath that right leg. And let me see here if I can't get a pointer or something on here. Ah, darn. Hold on for a second. Oh my gosh. Pointing the wrong way. All right, well, I guess I can't figure out where my pointer's at on the screen. So, well, anyway, um, that right leg, I'm running my pointer back and forth over her right leg, is in an L shape on the pillow. And what that does is it allows you to have access to the left inside leg if you need to access that. You can access the right outside leg. Now remember, and you're going to be like, Stacy, who said this? And it's just been different classes that I've taken. It's especially when you're working with pregnant women. I don't know, like I was saying, keep your treatments simple. You can, without concern, just do points on one side. Meaning, like if you needed to do stomach 36, you can do it on the right side without trying to figure out how to get in their left because they're laying on their left side. It's almost impossible. And it will work. It will work. So this will give you access to the outside of the leg on one leg and the inside of the leg on the other. And it will be okay. It'll be okay and it will work. It's okay if you do it on one side. Every once in a while, it's okay. It's okay. The other way I'm giving you, here's some other pictures, gives you kind of a view from the back side. You see how that right leg is up on the pillow again. And one thing to notice, the bottom picture. So see how that woman, I mean, this is like some cutesy, probably spa picture or something, and she's got her little hand daintily on her abdomen. Well, one of the things to think about is when you're working with a pregnant person, have a lot of pillows so you can position them so they're comfortable with one leg forward, one leg straight back, that right leg out at an angle with enough pillows underneath them so they feel comfortable. But the thing I was mentioning about the bottom picture where she daintily has her hand on her abdomen, make sure you have a pillow, a thin pillow that is available. And you always say, hey, do you want this pillow to rest your abdomen on? Because sometimes women's abdomens are so big and it's uncomfortable for them to just lay on their side without a pillow underneath their abdomen. So ask them if they would like a pillow underneath their abdomen. It's very important. And then give them a pillow for their head. So they're comfortable. Poor things have been uncomfortable for months. Make them comfortable. Um, so that's positioning. That'll get you a long ways, and that's how you should really work with somebody. After the first trimester, this is the position they should be in. During the first trimester, sure they can sleep. I mean, you can treat them on their back, and then maybe a little bit past that trimester, I always think about positioning them and position them in that way. You can sometimes, if it's 13 weeks or something, you can ask them what position is comfortable. What position do you sleep in at night? Do you sleep on your left side mostly? And if they're like, I don't, it doesn't matter to me, then you can be a little more lenient on how you position them. Oh, but always to be on the safe side, keep them on their left side. It's good. So here, positioning. Here's a thing here. So we're going to go through resources. So I really, really, if you're going to work with pregnant women, Well, you don't won't have too many pregnant men, I guess. But this is an awesome book. She is Deborah Betts is really is provides a very informative book. I mean, I've got mine right here. Look at that. I've had that book forever, and it's a really great book. If you've not worked with anyone pregnant, pick that book up. Take a class, but pick that book up. It's a good book. It's a really good book. Another resource. Here's a person. I don't have any pretty pictures, but Yvonne Farrell, and you can find her on healthyseminars.com. She moved her, I mean, maybe she's, I don't know, I haven't kept up with her in years, but she moved her live classes to this platform a long time ago. It used to be called Pro D Seminars. And I looked her up on Healthy Seminars because I knew that they changed their name and that's what they moved to. And it looked like some of the classes that she offered in Pro D were no longer available. And it looks like she had a new, maybe new formatted one on dealing with women that are pregnant and using the eight curious vessels. It was a very fascinating class. The original one that she did a long, long time ago. Like I probably took it 13 years ago. But I took it right when I was after I got licensed. So if you can find that class, it's very informative, but all of her work is really good. And but she's another resource. All the other people that I've taken live classes with, I don't know if they're even teaching anymore. It's what happens when you get old, I guess. All of your teachers disappear. So th those are two great resources to look into when you're going down the adventure of working with pregnant women. But like I said, this is an awesome book. It's a good book. Sample treatments or simple treatments. So I've got down here, what is wrong with this picture? Because I was looking for some pictures for this presentation and I found this one. I was like, oh my gosh, I'm going to use this because this is horribly wrong. What is wrong with this picture? Look how pregnant she is. And they've got her laying on her back. That is horribly wrong. I mean, it's not like you're going to completely kill the baby, but doing that. But that person is probably uncomfortable. I mean, that is, don't put oh, someone, I've been doing this for a long time. I can't even remember if I've had anybody that pregnant that says, oh, I need to be on my back. This is like, I don't know who you were that, with this, that got your picture taken like this, but you should be ashamed of yourself. Um, this is way out of order, but I keep thinking about this and I didn't put it in a slide. But well, one thing, let's just close this one out. The simple treatments, do not put somebody on their back. Put them on their left side, or you're going to be in trouble. I'm going to come to your door, knock on it, and point at you just like this and say, get that woman off her back. Put her on her side. One of the things when you treat, I didn't put a slide down here. I should have, but I didn't. When you treat someone who's pregnant, so especially very big and pregnant, like that person there that should not have been on her back. Um, always tell women, babies love acupuncture. It is true because you will work on them, and what will typically happen is you get the needles in, you step outside the room, and about 7 minutes from the time you leave, the baby becomes active. And it will become active for a little bit of time, and then it calms back down. So let them know that that's okay because you don't want somebody to be laying there going like, my baby is really active, and that's worrying me because usually it's just like a little crescendo. It kind of the baby becomes active and then comes back down. It's interesting um, how much they do like acupuncture. I mean, if the baby is going crazy, you know, like it's getting, I mean, just going crazy, of course, tell them to notify you, but you just let them know that it's okay if the baby gets a little active while they're resting on the table. It's okay. And it's normal. I mean, and also say if your baby doesn't get active, it's okay too. But so then they're not worried about like, why isn't my baby moving? He said that baby is supposed to be moving and it's not. So you don't want them to worry. That defeats your treatment. But let them know that the baby potentially could be active, so they're not worried. So here's a treatment right here for morning sickness. I'm just trying to provide you a little bonus material because that is a big thing. Women will come in with this and be miserable, miserable with a capital M. So know how to work with it. So one of the things we look at when somebody comes in with morning sickness is eliciting the Chang Mai, because the Chang Mai is really good about uh, counterflow, keeping things from being rebellious and coming up. So we're gonna open the Chang Mai, and then you can do spleen 27 and then spleen 21. So a little lower. That harmonizes the spleen and stomach. It also works with counterflow as well. You can use CV12 is another stomach harmonizer. And then 36, because that strengthens the stomach and spleen. It works with digestion, works with the spleen. And you can, on their back, you can work with bladder 20, black shoe of the spleen, bladder 21, black shoe of the stomach. The other thing is do 20. We're going to talk about that in a little bit, but we'll do 20 on the top there because it has a big effect on uplifting the chi. I know you're working with counter flow of the chi, if not coming up, but this is just working with the general aspect of the chi, raising. Most of the time, if I work with any, we'll talk about this in a minute. If I work with any woman that's pregnant, I'm always going to always do 20. Do 20. It's a tongue twister. I will always do 20. And we're going to talk about that in a second. Another thing that you'll see, and you're going to be like, Stacy, this is a no-brainer, but this is what you do because, like I said, treatments are simple. Another thing that you might see a women for is fatigue and exhaustion. Once again, that little baby is growing, so it's cannibalizing all the resources that the woman has, so it can grow, and that's just nature. That's life. Not that the baby's being mean. It's just that's life. That's how it grows. So you can do for basic fatigue and exhaustion, bladder 20, back shoe of the spleen, and stomach 36. It's all about trying to build the mother's capacity to produce the resources that the growing fetus needs. If they have liver qi stagnation, some bloating, or just they need mood modulation and they need the liver. So liver 3, you can add that on with your basic 20 and 36. And then if they have blood deficiency, you can also do bladder 17. And along with bladder 17, if you think about what is it, the back shoe of the diaphragm, but you always see it as a back shoe point for trying to move the blood. And some books it talks about it nourishes the blood. Um, Add that on to your 20 and 36. It's not going to hurt because they're probably going to be blood deficient because they're being cannibalized. And then once again, hit that do 20. So it lifts the chi. So let's talk about, don't forget, do 20. And what does that point do? Think about the uplifting properties. It is about bringing the good chi up, not the counterflow stuff that's not supposed to be coming up. It's about uplifting the chi. So I always envision it as a nice safeguard against the chi dropping too much and the baby coming out. It's not that I've never had anyone go in labor when they're on the table or anything like that. I've never had anybody to miscarry because of any acupuncture work that I've done, but I'm always very cautious. And I always like using this point because I feel like it pulls the chi up to help as a safeguard. Don't forget when you're talking to your patient about after the baby's born, just mention to them, find out if they have any history with mental health issues, because as we all, at least Chinese medicine wise, hopefully understand, when there is some kind of emotional content with someone that's not healthy, then usually that means the organ that's involved with that emotion is weak. So that organ's already weak and they're having problems with it. Then once they have that baby and lose a bunch of chi and blood and yin resources, they are, it's not going to make it any better. It's not going to make those emotions any better. It's probably going to make them stir up even more. So we're a good resource for that, for rebuilding and strengthening the system after it's been weakened. So if they have any problems with stress, anxiety, or depression, you should be their go-to. I mean, they should definitely talk to their doctor too, but you are going to be a big resource, a big help. Because what do? Acupuncture builds chi and blood, and those are the resources that are lost when you give birth. And a lot of times that loss of yin fluids is going to really have a big impact on their emotional well-being. So if they have any history with stuff already, say, hey, you probably should get in and see me. Or if any of this stuff, if you don't have any history at all, but this stuff, the stress, anxiety, or depression does pop up, come see me because I can help. I know I can help. And then also I had down here, if they have an issue with post-birth exhaustion, we are a good resource too because we help build those resources back up that they've lost. We help build chi and blood. So we can be a really good companion for them. Well, a companion, it's not the teammate for them. That's the better term. I like that better. So don't forget that part because we can be big players in helping them recover with that, or from that, any kind of postpartum issues. And that's it, guys. Hey, thanks for joining me. Like and subscribe my channel and go out there and help somebody. All right.